What if the reason you have been forgetting things, feeling mentally foggy, and struggling to concentrate has nothing to do with aging, and everything to do with a simple vitamin your body is not getting enough of? Research shows that over 40% of adults over 50 are deficient in at least one critical brain vitamin, and most of them have no idea. Today, we are going to look at the three most important vitamins for brain health after 50. What happens to your memory when you run low on each one, and exactly what you can do about it starting today. Pay close attention to vitamin number 2, because its connection to memory loss is something most doctors rarely mention to their patients. Vitamin number 1, vitamin D. You have probably heard that vitamin D is important for bones and immunity, but what most people do not know is that vitamin D receptors are found throughout the brain, including in the hippocampus, the region most critical for forming and storing memories. When vitamin D levels drop too low, the brain's ability to clear amyloid plaques, the toxic proteins associated with Alzheimer's disease, becomes significantly impaired. A large study published in JAMA Neurology followed over 1,600 older adults and found that those with vitamin D deficiency had a 53% higher risk of developing dementia and a 70% higher risk of developing Alzheimer's disease compared to those with normal levels. 53% higher risk from a vitamin deficiency that is completely preventable. Here is the alarming part. Vitamin D deficiency is extremely common after 50 for two main reasons. First, as we age, our skin becomes less efficient at producing vitamin D from sunlight. Second, many older adults spend less time outdoors than they did when they were younger. The most reliable way to know your vitamin D level is a simple blood test your doctor can order. If your level is below 30 nanograms per milliliter, most doctors recommend supplementation. Many experts in brain health now suggest that maintaining levels between 40 and 60 nanograms is optimal for cognitive protection. Natural sources of vitamin D include fatty fish like salmon, egg yolks, and fortified dairy products. But supplementation is often necessary since food alone rarely provides enough, especially after 50. Vitamin number 2, and this is the one I mentioned at the start that most people are never told about, vitamin B12. Vitamin B12 plays a direct, essential role in maintaining the myelin sheath, the protective coating that surrounds your nerve fibers, including those in your brain. Think of the myelin sheath like the plastic insulation around an electrical wire. When it deteriorates, signals between brain cells become slow, distorted, and eventually stop working properly. B12 deficiency does exactly this. It slowly breaks down the myelin sheath, leading to nerve damage that manifests as memory loss, confusion, difficulty concentrating, and mood changes. The reason most doctors miss this is that B12 deficiency develops extremely slowly, and its early symptoms, mild forgetfulness, fatigue, occasional confusion, are almost identical to what most people assume is just normal aging. Here's what makes this particularly important after 50. As we age, the stomach produces less of a protein called intrinsic factor, which is essential for absorbing B12 from food. This means even if you eat enough B12-rich foods, your body may not be absorbing it efficiently anymore. The most B12-rich foods include beef, clams, salmon, sardines, eggs, and dairy products. However, because absorption becomes unreliable after 50, many doctors recommend B12 supplementation directly, either as a sublingual tablet that dissolves under the tongue, or as a methylcobalamin supplement, which is the most bioavailable form. If you have been experiencing unexplained forgetfulness, fatigue, or mental fog, a simple B12 blood test could be one of the most important tests you ever take. Vitamin number 3 is actually a powerful combination, vitamin B6 and folate, also known as vitamin B9. These two work together in one of the most important processes for brain protection that science has identified: controlling homocysteine levels in the blood. Homocysteine is an amino acid that, when elevated, is highly toxic to brain cells and blood vessels. High homocysteine levels have been consistently linked to accelerated brain aging, increased risk of dementia, and greater risk of stroke. Vitamin B6 and folate are two of the primary nutrients your body uses to break down and eliminate excess homocysteine. When you are deficient in either of these vitamins, homocysteine levels rise, and brain damage accumulates over time. A landmark clinical trial from Oxford University, the VitaCog study, found that supplementing with B6, B12, and folate together reduced brain shrinkage by 53% in older adults with mild cognitive impairment compared to a placebo group. 53% less brain shrinkage from vitamins that cost just a few dollars a month. B6 is found in poultry, fish, potatoes, bananas, and chickpeas. Folate is found in dark leafy greens, legumes, and fortified cereals. Together, these two vitamins are some of the most important and most overlooked nutrients for protecting your brain as you age. Now that you know which vitamins matter most for your brain after 50, here is the practical action plan. Step 1. Talk to your doctor about getting a blood test for vitamin D and vitamin B12 specifically. These are standard tests that any doctor can order and are covered by most insurance plans. Step 2. Focus on getting more of these vitamins through food first. Salmon, eggs, leafy greens, dairy, and fortified foods cover most of your bases for all three deficiencies we discussed today. Step 3. If your blood test reveals a deficiency, discuss supplementation with your doctor. The most effective form of B12 for absorption after 50 is methylcobalamin. For vitamin D, most doctors recommend between 1,000 and 2,000 IU per day for maintenance, with higher doses if your blood level is very low. Step 4. Be consistent. Vitamins work through long-term steady levels in your bloodstream, not through single large doses. Daily consistency matters far more than occasional high intake. So let's quickly recap what we covered today. Vitamin D deficiency affects over 40% of adults over 50 and increases dementia risk by 53%. Vitamin B12 deficiency slowly damages the myelin sheath around your nerve fibers and creates symptoms that are easily mistaken for normal aging. And low levels of vitamin B6 and folate allow a toxic compound called homocysteine to build up in the blood, accelerating brain aging and increasing dementia risk. The most important step you can take after watching this video is getting a simple blood test to find out your actual levels. You cannot fix a deficiency you do not know you have. If you found this helpful, subscribe to Sharp Mind After 50 and hit the notification bell. Every week we bring you practical, science-backed information to help you protect your memory and keep your brain sharp after 50. I will see you in the next video, and take care of your brain because it is the most important organ you have.